In this video today, we're going to talk about Brazilian Jiu-Jitsu, its injury rate, what those injuries are, what's most common, what's rare, and what to do about it if you happen to have an injury. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist, who also practices Brazilian Jiu-Jitsu, or at least attempts to do so. And so one of the things that I want to be able to do is to help individuals understand how can you be able to know how to win the fight against pain and get back to leading the life that you deserve, or in this context, how can you get back on the mats as soon as possible? So when we talk about Brazilian Jiu-Jitsu, surprisingly, there's been actually a number of medical studies that have evaluated just BJJ and what is the context of understanding potential injuries, both from competition as well as training. One of the things that we find out right from jump is that injuries are actually pretty common in training and not as common in competition as what we might think. So one paper, which was the assessment of injuries during Brazilian Jiu-Jitsu competition, it looked at the a number of matches that were present, about 2,511 matches, and basically we're able to equate that to 5,022 potential exposures. Of those 5,000 potential exposures from the two participants that were there, only about 36 injuries took place. It sounds like a lot, but it's not really quite as many as what you might think. The injuries that were present were broken down. Of the 36, 14 were due to some form of injury to the elbow, traditionally from an arm bar. Seven were injuries to the knee, normally from a knee takedown or guard pass in terms of the injury taking place. The ankle was about five from a takedown or footlock. The hand was injured about four or so, and it was normally more by happenstance by getting caught in the gi or trying to apply a technique. The shoulder was injured about four, and that was a Kimura or takedown. The hip had an incidental one rating within the context of this, and it was because of contact with the opponent, which wasn't clarified. And the cervical spine, meaning the neck, had an injury that was one out of the 36, and it was from a triangle choke. But when we compare this to other martial arts, BJJ actually is much less inclined to have an injury per exposure. So if there's been studies that have looked at this, and BJJ is about 9.2 injuries per 1,000 exposures. Wrestling is 9 to 30. Taekwondo is 20 to 139. Judo is 25 to 130. And MMA is about 236 to 286. So there's another paper that actually looked at the context of training and the degree of injury. It was an injury in Brazilian Jiu-Jitsu training that was put forth and evaluated by another group. And one of the things that they were able to see is that when you take a look, there's a number of different constructs of training issues with subsequent treatments that were provided. So what they found is training injuries occurred in about 91% of the individuals that they were looking at. And most of them were sprains and strains and occurred about 61%, 57% of participants. The other things, the more severe things like fractures were about 18%, dislocations about 11%, and concussions about 7%. The most frequently identified common injuries based off of body part in training were fingers, neck, knee, and shoulder. So when we talk about this, how many of those really resulted in a significant injury? About 15% of injuries required some form of surgery. And of those, about 55%, the physician advised the practitioner to take off time in order to be able to heal. One of the major challenges with that is about 20% of practitioners that had an injury ended up resulting in quitting BJJ. And so, one of the things that we really want to look at is how can you be able to get back on the mats sooner? And using regenerative medicine by utilizing your own healing aspects of your body by doing PRP, platelet rich plasma, or stem cells to help augment your natural healing can be incredibly helpful. There are a number of practitioners that have been able to really find their ways, both utilizing it as well as giving it. So one of the most famous practitioners is Joe Rogan, who's had a shoulder injury and has said on his podcast multiple times about how he was able to get benefit from an orthobiologic or regenerative treatment. In addition, there is a gentleman by the name of Tim Bruce, who has a clinic in Florida that treats patients with regenerative medicine type techniques and is also a BJJ black belt. Our clinic does regenerative medicine and treats all comers for knee, shoulder, spine, all those type of things. But I think that there's many people that have no idea that you can be able to do something like this, improve your potential health, and not have to have surgery, which takes you away from the mats, and be able to get back to doing things sooner. So if this sounds like something that's of interest to you, please leave a note in the comments about whether you've had an injury, how you healed from it, whether you had exposure to regenerative medicine, or whether you want exposure to regenerative medicine. At the end of the day, we want patients and people to understand that you have options and you're not just forced into one path. We want you to be able to win the battle against pain, how to be able to punch, or rather, how to be able to choke pain and get back to living the life that you deserve. Thank you so much and have a great day.